discuss some important bacterial diseases in brief. Okay, we cannot go in details of all these diseases. Time is very short. So I'm just picking up first about the tuberculosis, TB in short. All of you might have heard about this disease in human also. Tuberculosis is a very common bacterial disease. Okay, so it is a very chronic, progressive, and a wasting type of this bacterial disease of animals and man, and mainly caused by the bacterial species known as Mycobacterium. Okay, and the main characteristic feature of this disease is that tubercle formation, tubercular nodules, as we have already learned in case of this inflammation, chronic inflammation, granulomatous inflammation, right? So there we have talked about the, this tubercle, that is one kind of this nodular lesion. Okay, some nodule, this tumor like a little bit, this nodular lesion, and where means if you cut the this such kind of these tubercles or these nodules, the central part used to show the causative necrotic lesion, and the outer, this that used to be, this encapsulated, this covered by fibrous connective tissues. That's why it gives a little bit hard and firm type of these nodular lesions. And such kind of these tubercles or tubercular nodular lesions used to be found in many of the these organs, mainly lungs, spleen, lymph nodes, and of course, this TB may be of different this affecting many system, different system, even your this skeleton like bone TB. Then even your this brain, tuberculoma, we used to call it tuberculoma. TB in the brain. So like that, many system, many organs can be affected, right? And the main etiological agent and for this disease is Mycobacterium tuberculosis. So far, the bovine are concerned Mycobacterium bovis, and in avian Mycobacterium avies. I think avium. This you might have heard it or learned it. Okay, and many species of this animal. This can be affected, including this human, right? So this kind of this disease is very commonly this occurring among this animal species. And so far the transmission and the spread of this disease is concerned mainly from this affected and the sick animals, which used to excrete the bacterial organism through their breathing, coughing, or sneezing. Okay, and when they are this coming into contact with the this new host or some healthy animals, so through these aerosols coming out from these affected animals through the this coughing or sneezing or this breathing, or sometimes indirectly this may be through this contamination, this or ingestion through the contaminated food and water with this infected material and all. Also, this mostly that means through inhalation. So it used to, the healthy animals or susceptible animals used to get the infection when they are coming in close contact with this kind of this affected animals, and through ingestion also. This mainly just getting through the this digestive system through the pharynx, and the small intestine is spreading towards the nearest this lymph nodes and all. So mainly in this both this mode of this transmission, maybe through inhalation or maybe through ingestion. So the nearby, these lymph nodes used to be targeted and affected from there through lymphatics. They used to go into the system, and the circulation and all. It used to be this spread out to other system and organs. And the transmission or this establishment of this disease, it may depend on some factors like age. Number one, that means younger animals are less susceptible. Okay, this in case of this animal, whereas in case of this, a human, it is more. And malnutrition, that means when there is malnourishment of these animals. Okay, so they readily contact this disease. Under malnourished condition. And intercurrent infection, that means some other disease condition is their immune system is down, and they are already weak due to some other this infection. Okay, so that also will increase the establishment and the further damage of the different organ and system and this. Then hygienic condition, number 4. So poor sanitation and poor hygienic condition as well as poor ventilation. When in that condition the animals are kept, that will increase the entry and the establishment of this infection. Okay, and lastly, the management practices, like when you are keeping the animal, means overcrowded condition in an overcrowded house, or common drinking and the feeding traps are there. I mean, they have not been separated from different group of this animal. It is common for all, like, so that will also increase the transmission and the spread rate of this infection. Okay. And this disease is, I have already mentioned it, that primarily means it used to target the respiratory system through inhalation. Okay, but it doesn't mean that it affects only the respiratory system. So main risk of this cattle so far animal is concerned, contracting this infection mostly from inhaling the bacterial organism, that means the Mycobacterium bovis, and maybe from direct contact with an infected animal, or maybe sniffing an infected area such as badger latrine. Okay, and through contamination and all. And I mean, this disease, it actually used to develop very slowly, and it takes time to develop and to grow these lesions there in the different organ, mostly in the lungs. Okay, it takes time. So that's why slowly and progressive type of this disease. I mean, it is a chronic progressive type of disease. It doesn't grow and doesn't show very soon. Like, I mean, this once you have been infected, like, I mean, it will take time to show the signs and symptoms, and even this lesion, like your tubercular nodular lesions and all these things. And these lesions have to open up before the cattle start coughing out the bacterial organism. Means that tubercle, this tubercular nodular lesion, which may be formed, they may be formed there in the lungs and all. So that should open, that should be opening out and to release this organism from this starting coughing out the bacterial organism to this coughing. Okay, and this is about this cycle about this bovine this Mycobacterium bovis transmission. So this way, the animal affected animal may spread out and maintain this disease and all, and these humans may also be contracted this infection from the infected animal, maybe the close contact, or like sometimes through ingestion of the infected meat, or like this milk and all these things, right? Human can also be this affected. Then coming to the pathogenesis one here, I would like to say something about this pathogenesis. This part is important for any of the diseases. Pathogenesis part is important. When the animal used to contact, I'm talking about healthy animal, susceptible healthy animal with the infected animals, maybe through discharges or morbid tissues, through inhalation, those aerosols containing this Mycobacterium organisms and all. So this organism mainly, as I was talking about, through coughing and sneezing, coming out along with a sputum or droplet infection and all these things. So, or sometimes it may be, the sources may be through the fomite, like your instruments, utensil, beddings used in the farm, like, and after going into, the system, and through inhalation, like in the respiratory system nearby this lymph node and all. So they used to localize down there and producing the typical nodular lesions, what we call tubercle, in those regional lymph nodes. And mostly these lymph nodes are of the pharyngeal and mesenteric lymph nodes. Okay, in the digestive system, mesenteric lymph node, and pharyngeal in the respiratory system particularly. And those inhaled Mycobacterium organisms enter into the bronchial tree. I'm talking about the respiratory system, and attacking these cells like macrophages. Then they used to form these epithelial cells. Then giant cell formation and lymphocytes may be present out there at the surrounding area, and fibrous connective tissue will be formed around this tubercle. That will cover up the lesion where this tubercle is formed. I mean, that means central causative necrotic area surrounded by this kind of this inflammatory cells like macrophages, epithelial cells, giant cells, and lymphocytes and all. Yes, I think you must be remembering those the slides about the granulomatous inflammation. Their granuloma, I have shown you, I think. And this kind of these lesions, center causative necrotic area surrounded by these inflammatory cells, used to be covered by, fibrous connective tissue on this tubercle. That's why it gives hard and firm, okay. And the dead bacterial organisms are generally destroyed by the WBCs, white blood cells, that the body used to fight the infection, the immune cells, right? And however, they, this some invade, this evade the destruction and increase in number, okay. And these type of these large clusters are often visible to the naked eye. They resemble abscesses or so-called tubercle. Means this kind of this lesion, where this nodular lesion, are formed. Of course, it is little bit abscess type, or you can say little bit nodule. That is this growth, some growth, and this nodular growth. Okay, and particularly in case of this TB, it is termed as tubercle. And if you make section, this this grossly, the central part will show some cheese-like material that is due to causative necrotic lesion or necrosis. Okay. And these very particular tubercles used to be formed in those, these affected organs. Mostly, I'm talking about just lungs, but it doesn't mean that only in lungs, maybe in the mesentery, and then sometimes in the, this pericardium, or like, maybe even in the spleen or some other organs, like, okay, and the system, even in the brain and all these things, right? Even bone, like, okay. And following the infection, some immune response used to be mounted by this affected host animal, and a weak response allowing the bacteria to increase its number, producing further tubercles and lead to localized, these necrotic lesions. Means many other parts, they will be developing such kind of causative necrotic area, and they will show the presence of these tubercles. Okay, these are some of the this lesions, X-ray and this lesion where this primary and these lesions commonly known as Ranke complex. This is nothing but the combination of the calcified lesions of the lungs as well as the lymph node. Okay, when they are affected by this Mycobacterium, this bovis, and referred to as it is this Ranke complex. Okay. Now coming to characteristic signs and symptoms. Initially, the animal, this almost means when we are talking about any kind of this infection and all these things. So fever is one of the very common, but here low grade, no high type of this, high rise of this body temperature, low grade type of this fever will be there, and the animal will show progressively wasting, weakness, and loss of production. This progressively means slowly and slowly, not suddenly. Means it takes time, maybe months and just years and all this, right? So progressively they will go on wasting and just becoming weaker day by day, losing their body weight, emaciating and all, and this loss of production and all. And they may show persistent coughing, then loss of appetite, and the loss of body condition. And this type of this clinical signs in case of this tuberculosis may depend upon which organs are infected. Which organ have been infected. Depending upon that, the signs and symptoms may be. Suppose, for example, this digestive system, this intestines and all. Then chronic diarrhea may be there. Okay, but lungs is there. Then respiratory signs, coughing, and some this pneumonic changes and all these things. Chronic type of pneumonia, like. Okay, means it is depending upon the organ or the system affected. So that's why this some different type of this clinical signs and symptoms may be there, right? And in all these cases, of course, the most commonly they may have this low grade fever, then progressively this wasting and weakness, loss of production, and these things, and the loss of appetite and loss of body condition. These are common in all this. Okay, and with the progression of this disease, generalized form of this TB and this tuberculosis may ensue, leading to severe this heavy weakness, debility, and ultimately death, or predisposing to depredation. I mean, they may be very much weak, and the animal may be, I mean, this prone to some other, I mean, this predation, means other infection, and this because of the, I mean, the very living things, right? Or and they may die also even because of this, I mean, this very, and this severe way, this and this involvement of some vital organs and all these things, right? So even they may die. Then growth changes, I mean, the organs and this system, when these different organs and the system are affected. So mostly in all those affected organs, I'm now just giving about the lungs and some other organs, like, so consolidation of the lungs with formation of many nodular lesions, what we call tubercles. Okay, and like this kind of these lesions. Okay, this is in the spin, of course, like this. So this nodular, like this, these tubercles, nodular and these tubercular lesions, when you make this section and all, of course, I mean, they will show central causative cheese like this material inside the this center of this nodule, I mean this tubercle. That is nothing but due to causative necrotic lesion. Okay, and these are termed as what we call granulomatous lesion also. Okay, right. So it may be not only in the this lungs, maybe in other organs like spleen, then lymph nodes, liver, intestine, and many other this organ according to different this system involvement. And when such kind of this nodular lesion, very tiny or this small these tubercular lesions, okay, on the pleura, peritoneum, as well as on the mesentery, as I am just showing here. Okay, very small nodular lesions, tiny, and this, and if they are present on this kind of this membrane like this pleura, peritoneum, as well as mesenteric membrane, mesentery, and all these things, right? So it is looking like that some pearls have been dispersed and spread out on this surface like this. Okay, so that's why this very particular condition, okay, I mean, it is known as pearly disease. Okay, so pearly disease is nothing but, I mean, when the small, tiny, and this small these tubercular lesions, okay, are formed on the these thin membranes like this pleura, peritoneum, as well as the mesentery, giving an appearance that, I mean, just looking like, I mean, some pearls have been spread out or dispersed on this surface and all. So it is known as pearly disease, and this is very important for your examination and even Bible was here concerned, right? And these are some more this pictures showing the this tubercle, those TB nodules. I'm showing this central causative necrotic area and surrounded by, and these are miliary. I mean, this miliary means small. I mean, this surface on the pleura, right? Oh, and this is a schematic diagram as I was talking about. If you make section, as we have already discussed, of course, in granulomatous inflammation in chronic this inflammation chapter, right? So there, if you make section, see under the microscope also, this is a schematic one, not actual, and this picture, actual picture, I'll show you up in the just later slides. So central part used to show this central causative necrotic lesion, surrounded by many inflammatory cells like your macrophages, epithelioid cells, then few giant cells, multinucleated giant cells, okay, and lymphocytic cells and all. Okay, and finally, means here it is not shown, of course, and this area, I mean, this finally used to be covered by fibrous connective tissue. Then only it will give that kind of this, I mean, this nodular form and hard nodular lesions on those affected organs, maybe like your lungs, spleen, liver, or any other these organs, right? So these are some more these pictures of these tubercular nodules, I mean, in the different parts on different animals. And microscopically, this is very important. And this, of course, we have already discussed in the granulomatous inflammation also. So we used to call them as a granuloma, as this common terminology to show the TB lesions, microscopical these TB lesions and all, right? So this is nothing but granulomatous inflammation, where the central area, central part, see, this central causative necrotic lesion, which may be calcify or may not be calcify. Mostly in case of this cattle and all these things, it used to be calcify, calcium salt deposition, giving very purple, this deep purple color, okay, bluish and purple color. This is showing the calcification is the calcium salt deposition. And the pink, deep pink, this lesion, this is nothing but the causation, cheese-like material. This is due to causative necrotic, this area, lesion. And encircled by or surrounded by many inflammatory cells, okay, here, including your macrophages, epithelial cells, then I mean a few multinucleated giant cells, Langerhans type of these giant cells mostly it used to be, okay, and lymphocytic cells. And finally here it is shown, okay, finally this it is covered by fibrous connective tissue. So this lesion commonly known as granuloma, right? So this granuloma formation or granulomatous inflammatory reaction is a very typical this microscopic lesion of this tuberculosis. Okay, so as I have already mentioned, this central necrotic area means in some cases, not in avian, except in avian. So it used to be normally this calcify, means calcium salt deposition used to be there, right? And finally surrounded by fibrous connective tissue like this. Okay, because of that, it gives very hard and firm. Then finally, diagnosis. So basing on the clinical signs and symptoms as well as the lesion about your tubercles and all these things, the tubercular nodular lesions. Okay, then in living animals, live animals, we can conduct a test known as tuberculin test. Two different types are there: single intradermal, this tuberculin test, double intradermal, and this tuberculin test. Okay, so these two, I think you might have learned in details about this technique, how to conduct this type of this tuberculin test. I hope in microbiology, bacteriology, you might have learned it. So I will not go in details about this. These are some allergic type of this and hypersensitive type of this reaction to see the this skin thickening, erythematous swelling, and all these things after giving this injection after this 48 hours, then 72 hours, all right. First injection, then a second injection, if it double intradermal, like so. By showing that from the site of the infection and this is injection, so that kind of this erythema or erythematous swelling and the thickening of the skin used to be there, and it used to be measured by slide caliper and all these things. So this 3 mm and above, used to be considered as this positive case reactors, and down below that means considered as negative. Like that means those techniques means you might have learned in details, I think, in my bacteriology. Then immunodiagnostic techniques like ELISA, for mass screening, then demonstration of this very particular this organism, Mycobacterium. They are acid-fast organism, this bacilli. And travel board that is making smear from the sputum, like sometimes the milk and the morbid materials, and it should be stained by gel nasal stain. This is specific stain for this acid-fast organism, and see under the microscope. Then you can just demonstrate the presence of this acid-fast organism, that Mycobacterium bacilli, right? And sometimes cultural examination can also be conducted. In the this dorsals egg media can be utilized for this purpose. Then animal inoculation tests also can be conducted by using this guinea pig, and radiology to find out this nodular lesions in the x-rays and all these things, tubercles in the this affected organs, like mostly like your this lungs. Okay, then next disease is about paratuberculosis, commonly known as John's disease. Here also, this is also chronic and this progressive type of this disease, highly infectious as well as contagious, and affecting mostly the gastrointestinal tract of the this ruminants, okay, like bovines, ovines, and caprines, mostly caused by Mycobacterium paratuberculosis. And the main characteristic feature of this disease is that it is more or less similar, some little bit about the this TB and all. Here also, the animal used to be very this weak, dehydrated, progressive emaciating, and the chronic diarrhea. And one very particular lesion used to be there in the affected this intestines. Okay, that is what we call corrugations. and this thickening of the intestine, forming some ridges like folds, many folds, as well as this much thickening, that is known as corrugation. So that is very much typical. I'll show you the picture. Okay, and as I have already mentioned, this etiology, Mycobacterium paratuberculosis, also known as Mycobacterium jejuni. Okay, and this is another acid fast and this organism bacilli, right? Then pathogenesis means it is the main and this source of this infection is the feces coming out from the infected animal when it is contaminating. Okay, or this the milk this coming out, this is excreted from the affected this animal, that infected material, milk or this feces like this material may contaminate the feed and water. While ingested this such kind of this contaminated food and water and all this, the healthy animal may contract the infection. After getting into the system, it may localize particularly in the intestinal mucosa and the nearby lymph nodes. And here means they may start this this inflammatory reaction, this coming out with this macrophages and all these things, and multiplication, and this maybe this going on there in this intestinal system and spreading there, and it may be distributed to the other parts of the this body, particularly from the ileum and the large intestines. Okay, and decreased absorptive surface of the intestines used to be there, leading to chronic diarrhea and malabsorption. So that's why mostly the affected animals used to die because of this excessive dehydration and emaciation, due to loss of this body fluid and all these things. So this type of this chronic diarrhea and malabsorption, that will lead to that of this affected animal in very chronically disaffected and this progressively wasting type of this disease. This is another. And the characteristic signs and symptoms of this disease is that there will be chronic diarrhea. And if you see the direct feces, it will show dark color feces which may contain some bubbles. Okay, and the animal may remain very much unthrifty in the dry coat without fever. Means there may not be fever, and progressively they may show wasting and weakness as well as loss of production, similarly as in case of this tuberculosis. And one very particular thing means it is there also, it should be in case of this TB also, known as hidebound condition, because of the wasting and this running condition of the muscular tissue and all these things. So the skeletal this used to be very much prominent, as I'm showing here. See this rips here, they are very much prominent. The muscular these tissues are wasting and the running condition, this losing, wasting type, right? And when they are very weak, dehydrated, in emaciating condition and all. And this very prominent, this skeletal and this mostly these ribs and all these things, and the wasting of this muscular tissue and all. So this condition is known as hidebound condition. Okay. And in case of this sheep and goat, diarrhea may not be there, but the feces may remain very soft and emaciation also be observed. These are some more this picture showing very emaciated, very weak, this runting or this this wasting type of this body or this muscular tissue and all, and hide and bound condition. Okay, very weak. And then gross changes. The one what I was talking about, thickening of the intestine, showing this some ruggy. This is also known as presence of ruggy or ridges in the form of this ridges. See here. The intestinal mucosa, it used to folded into many of these ridges. Okay, this is termed as ruggy, like, as well as the intestinal wall used to be very much thick. So this is with this very particular thing, and means it is termed as intestinal corrugation. So it is a very typical characteristic gross lesion of this disease, Jones disease or this paratuberculosis. Okay, and the animal is a very cacacic condition, and this this highly emaciated and dehydrated condition and hidebound condition will be there. Externally examination, if you see that, and This kind of just corrugated intestines means when they have been fall into many and this ridges, ruggy and all, and the intestine have been, I mean, is very much thickened. And when you stress it, I mean, by stressing this intestinal wall, even it will not go off. I mean, it will remain like this. So that kind of this corrugation, which is very much characteristic cross lesion of this, I mean, this paratuberculosis or Jones disease, as well as the regional lymph node, mostly the mesenteric lymph nodes like this. So they may be enlarged and swollen. Okay. And these are some more pictures of the, I mean, this intestinal corrugation. See this transverse type of this ridges or ruggy in the this intestine like this. Okay, these are real pictures of the affected intestine as in case of your, I mean, this this tuberculosis or Jones disease. Then finally, this microscopic changes when you conduct, I mean, this next sections of this affected this organ, mostly this intestine, and where, I mean, you have this type of this, you know, I mean, this ridges or, I mean, this corrugated this intestine and all this thing. Sometimes little bit some nodular type of this lesion, means not exactly like your, I mean, this tuberculosis and all, it may also be there, but mostly this very much thickening and ruggy formation or ridges and this folds, many folds of the intestinal mucosa on this wall, what we call this corrugation. That is the most important, I mean, this gross lesion. And you make a section of this intestine and this affected parts and all, then you will find that in those areas, aggregation or presence of many inflammatory cells, similarly like that of your this tuberculosis, this macrophages, epithelial cells, and this lymphocytic cells. But giant cells, sometimes it may be present, like I'm just Langerhans type of these giant cells, as I'm showing here, this multinucleate, okay, or may not be. I mean, this in many of the cases, of course, it used to be, but sometimes it may not be. And presence of this organism, this, I mean, mycobacterium, this Juni, or this paratuberculosis, they are also acid-fast organism. So they used to remain present in those epithelial cells. Okay, means in those epithelial cells surrounding this central this area, this necrotic lesion. So similarly, I mean, in case of this, I mean, this tuberculosis, when we are talking about this paratuberculosis and all, so in case of cattle, when we are comparing with this tuberculosis, I mean, this mycobacterium, this tuberculosis or bovis infection and all, and in case of this TB, central causative necrotic area as well as calcification is very common, right? But here is in case of this mycobacterium, this paratuberculosis, or I mean this Jones disease, it is not like that. It used to remain absent particularly. But so far sheep and goat are concerned, I mean, they may show the similar type of this causative necrotic, this area in the center, and this calcification. Okay, and there may be presence of many, I mean, thickness of these epithelial cells. I mean, when we are talking about the section of the mesenteric lymph nodes and all these things like this. Okay, so these are some more, I mean, this microscopic picture. Then finally, diagnosis. So basing on the clinical signs and symptoms and lesions, so mainly of those, I mean, the progressive wasting, then chronic diarrhea and intestinal corrugation. These are very much important for so far this disease, this paratuberculosis or Jones disease is concerned. Then you can go for demonstration of the acid-fast organism, particularly in the rectal and this pinch from the this rectum. If you collect some tissue, I mean, this and this make it section and see under the microscope after staining with, I mean, or making smear or like, then staining with this gel modified gel Hansen stain, then we can demonstrate this acid-fast organism under the microscope. Okay, and similarly, like your tuberculin test in case of this tuberculosis, here another intradermal or intravenous type of this injection means not as Jonin test can be conducted for the live animals. Okay, and immunodiagnosis takes similarly like that of this ELISA for mass screening of the affected animal in the farms and all this can be conducted, and some other these serological techniques, this complement fixation test, heme agglutination test, gel immunodiffusion test, fluorescent antibody technique, radio and this immunoassay and all these things, they can also be, this may also be conducted for this diagnosis of this very particular disease. And the demonstration of this organism is, I was talking about the acid-fast organism. I mean, in the tissue, I mean, second also can be this used. I mean, this demonstrated by taking this especially stent, and you can demonstrate the presence of this organism in the affected tissues. Right. Then another this disease. Another two more diseases we'll discuss in brief, that is actinobacillosis and actinomycosis. In both these diseases, this one very common condition is that granulomatous abscession here. One, I mean, it used to involve the soft tissues, whereas in case of the this actinomycosis, of course, it used to affect the hard tissues. Okay, the mandible and all these things, the jaw and all these things. Here means mostly this tongue. Okay, it used to be affected in this mouth cavity, and this bacterial disease, I mean, mostly affecting the ruminants, like primarily, you can say talk about the cattle, and where you may have typically the characteristic lesion is that formation of granulomatous abscession, this chronic type abscesses with very hard diffused nodular type of the swelling of the tongue. Okay, and means tongue used to be very hard and firm and wooden in nature, like that's why the synonym of the disease has been given as wooden tongue. Okay, and if you see examine that, means the tongue used to be very much enlarged, firm, and it may contain so many of these granulomatous lesions. Okay, means many of these granulomatous hard and this nodular, or you can say, some chronic abscesses type. And this very particular this affection on targeting the tongue is showing very much hard and firm content because of the this granulomatous lesion, chronic this abscess lesions type and all. So because of this, this condition or the disease is commonly known as called as wooden tongue, caused by Actinobacillus lignarigi. Okay, and this kind of these organisms, when this organism maybe remain as a normal inhabitant of the ruminant as well as the mouth cavity of these animals like your cattle, sheep, and sometimes even this in case of this goat. But when they are this normal inhabitant of the ruminant, how they may cause and enter into the system affecting their soft tissues and all these things. That is when the animals are just showing some penetrating wounds or traumatic injuries, even maybe during feeding some rough phases and all these things, straw and all these things, like okay, that may cause some this abrasion or some this traumatic injury, penetrating wounds on the mouth cavity. Okay, mouth mucous membrane as well as your tongue and all these things. So that's why this organism used to gain entry through those this injured part or abrasion and all these things. Then they may localize the infections down there, forming your this granulomatous abscesses, or it may spread through the lymphatics and towards the other tissues and organs, right? And this is already we have discussed and all. Then characteristic signs and symptoms. In case of this cattle, mostly we were talking about the affection, the target organ, that is tongue. So when you manipulate or examine the tongue, so tongue used to be very much enlarged, okay, firm and hard. And because of this affection of the tongue showing very much wooden nature, like very hard and firm, and this swollen and all these things. So the animal may not be able to take food. Okay, inability to eat, like they are not able to take the food and all. Then there will be hypersalivation, termed as stylism, with difficult mastication. And when you manipulate, when you examine this tongue for this such kind of this lesion and all this, where granulomatous, this abscesses may be formed and all, very hard and firm and all. So the animal used to show very much pain because of these lesions and all. And the surrounding areas, the soft, other part of the soft tissues down there in the chest area and the brisket and all these things, they may also show this this kind of this granulomatous abscess and abscess formation, chronic type of this abscesses, when this organism, after affecting this mucous membrane of mucosa, as well as most commonly this tongue, through the regional lymph nodes and through the lymphatics, they may be spreading out and affected some of the parts and of this nearby this body part, as well as the system, right? And if you see this kind of these lesions as I'm showing here, I mean, very much enlarged this tongue where and this granulomatous and abscession formation used to be there, and these nodular lesions may also be and this present in other this system and organs like your and this rumen, sometimes in the skin, lungs, and this even this liver and all. And from all these type of these lesions, so when you squeeze and all these things, so pus will be coming out from these lesions. Okay, mostly, I mean, of course, tongue is one of the most target organ. So from those target, I mean, also granulomatous type of this abscession, and so if you press or this squeeze or not, very thick pus used to be coming out of this lesion. And when you crush this kind of this and this pus and all these things in between two slides and all, you may find some granular lesions, small white, yellowish granules. So those are these are some other nodular lesions, and this abscess and granular type of abscession for these two different parts of the body. Okay, means after spreading through the lymphatics and all these things, right? And this, so those, I mean, I was talking about, if you squeeze and press those abscesses, I mean, inside those and this pus and all, some yellowish granules, okay, may be present. So looking like sulfur granules, sulfur and this granules. So that's why these are given the name and the term as sulfur granules. And if you cross this kind of this granule, I mean, into two slides and stand it, or and if you see even without stand also see under the microscope, particularly in the sections when, I mean, the tissue which is showing this kind of this granule, this abscess and anomalic section, and stand it, then you can see such type of this lesion where these granular lesions are there, showing the Indian club like I'm just rosettes, I'm radiating club from the center, okay, like this, from the center radiating, I'm just raised like I'm the ray fungus type of these lesions like this, okay. And these are known as club like rosettes and all. And in the center, of course, there is to be presence of those and this bacterial organism, this Actinobacillus lignariae, and this Indian club like this, or this ray fungus type of this structure. So this, I mean, this central part, I mean, that used to be surrounded by many inflammatory cells like neutrophils, mononuclear cells, and lymphocytic cells. Mostly in this neutrophil, because here it is, I mean, this liquefactive type of this necrosis means abscess formation is there. So any kind of this abscess lesions or where the inflammatory and this reaction is of suppurative type, or abscess is formed, pus is formed and all, the predominant inflammatory cells used to be neutrophils, okay. And finally, such lesions used to be surrounded by fibrous connective tissue. So it may give little bit hard and firm like a nodular lesion grossly, and muscle tissue of the tongue used to be replaced by fibrous connective tissue. That's why muscle used to be very much hard, just like a wood. That's why we call wooden tongue, right? Then these are the, I mean, this same thing means, as we have already discussed about, I mean, those radiated structures arranged in the palisade form Indian club like or ray fungus type of this structure from the center, and there may be presence of the organism in this center, very center part, and surrounded by many inflammatory cells, and finally encapsulation by fibrous connective tissue, right? So this is nothing but about the actinobacillosis granuloma, like your and this TB granuloma. I mean, here means one thing is that means you won't find any your what is that, giant shells. Okay, giant shell formation is not a common feature here in case of actinobacillosis. And finally, diagnosis, it may be basing on it can be done based on the clinical signs and symptoms and lesions mainly of your this tongue, this then other this chronic abscesses and all these things. Then you have to go for confirmation of this disease by isolation of the bacterial organism. So you can demonstrate this organism or colony of this organism in the tissue sections, and microscopically when you conduct these sections of the affected organ wherever this nodular or this chronic abscesses lesions are there in those organs, make section, see under the microscope and all, and you can demonstrate the presence of these sulfur granules. Okay, and or if it is crossed into in between two slides and see under the microscope, you'll find those sulfur granules consisting to what's a club like Indian club like, or this rare fungus like this, and this structure in the center, and in the very particular area in the center you may demonstrate the presence of this this gram-positive organism, this actinobacillus. Okay, then lastly for today, actinomycosis. It is commonly known as, the synonym is lumpy jaw. As in case of this actinobacillosis, it used to target, here also this organism also used to remain as a normal inhabitant in the, this very particular, this healthy animals and all that. But when they have some abrasion or this traumatic injuries in the mouth cavity and all, there it means they may this gain entry, and they may show the flare up and take up the pathogenic role, right? And this again, it is a very common bacterial disease of the cattle, buffaloes, as well as the camels, caused by actinomyces bovis. Okay, and the main characteristic reason is that here suppurative type of this osteomyelitis. That means, the bone as well as the bone marrow. That is known as osteomyelitis, and this inflammatory reaction or condition of the bone as well as the bone marrow. Okay, but what kind of this inflammatory reaction of this bone, particularly this mandible and the mandible, and sometimes it may be spread towards the lung. Okay, most commonly. And there in the mandible, when you check it, okay, like this in the mandible and this mouth. So here also granulomatous type of this this suppurative inflammatory reaction used to be showing their chronic type of this abscesses in this affected mandible. So if you see that not only the bony tissue, even the bone marrow used to be this affected, and there is a pus accumulation showing that chronic pus is formed like in this abscesses. And so this kind of this condition is termed as suppurative or rarefying osteomyelitis of the mandible, and this lesion may extend. There means you may find small nodular lesions, that is miliary nodular lesions in the lungs. Okay, so because of the main targeting this part of the body organ like this your mandible, so the jaw particularly, so it used to show lumpy in nature like this, because of the swelling and this because of the lesions showing this chronic granulomatous and this inflammatory reaction there in the those bones like jaw, and this mandible and all this. So it has been given this name, lumpy jaw, right? And this is already we have discussed pathogenesis. When we talk about the entry of this organism through the abrasion of the injuries and all these things, then affecting this hard tissues like your mandible, okay, jaws and other this part of the jaw, causing granulomatous inflammatory reaction with suppurative inflammation, right? And the characteristic signs and symptoms of the affected animals may be loss of appetite. That is mainly due to pain in the jaw, mandible jaw. When they are affected, they used to feel very much painful, and they cannot chew and the food materials and all. So they will remain without taking food, and also, and they will have show the loss of this appetite. Okay, mainly because of this pain, and there may be abscess formation, chronic type of this abscess, granulomatous type of this abscess, particularly in the mandible and jaws. Okay, at the parts of the jaws which may be much swollen and this hurt and form. Okay, and from those this affected parts and all, when you squeeze, press and all, discharging, here also flooding, or just coming out of the pus from these lesions used to be there. So these are some of the gross lesions in the just mandible like this, and the jaws. Okay, chronic this abscession is used to be found there. And externally means it may show the jaw and this area, this mandible, this jaw area, it may used to be very much enlarged, and sometimes it may show that from the overlying skin, pus is coming out, and some nodular type of this growths are there, and in that mandible as well as this jaw and all these things. So the affected animal may show such type of this swelling, this jaw or this mandibles and all, and they will show very much painful when you touch it, and for examination also they will feel very much pain. Then grossly means jaws used to be lumpy in nature, means very hard and firm and enlarged, swollen and all, and there may be swelling of the this mandible also, and some this due to the extension or spreading of this infection to other parts, mostly this lungs, where you may find small nodular lesions, that what we call miliary nodules in the lungs, as well as down there in the mammary gland. Okay, and from all these these lesions, they may show the discharges of the pus discharges will be coming out of this. And here also, if you squeeze and crush those pus material, and then in between two these glasses, glass size and all this, you may find some yellow granules. So these are also known as sulfur granules, but it is little bit different in size, from your, this sulfur granules found in case of your, what is that? This actinobacillosis. Okay, means sulfur granules are both, are found in both the disease condition, actinobacillosis as well as actinomycosis. Okay, and the size of this granular, sulfur granules or the yellowish granules found in case of this actinomycosis and actinobacillosis. So, as in case of this, this actinobacillosis, the size of these granules are more in size or bigger in size than actinobacillosis. Otherwise, it is almost more or less same. Okay, and it is difficult, of course, to compare the size. And when you collect from the both the lesions and then only you can get, oh, this one is bigger and this one is smaller. But the color and all this thing, it will be more or less same, yellow and these granules, right? And the bones, like this mandible, jaw and all, they may show inflammatory reaction, what we call this suppurative osteomyelitis, mainly of this mandible. Then central liquefactive necrotic area with colonies of this bacterial organism, in the sections, okay, like this, and many this central causative necrotic area like this, okay, and surrounded by many organisms inside this, like this. So many these bacterial organisms of this actinomyces bovis, and this area used to be surrounded by many inflammatory cells, like as that of in case of this actinobacillosis granuloma like. Okay, so many inflammatory cells may be of mainly this mononuclear cells and lymphocytic cells may be surrounded this area, and presence of this granular, this yellowish granules, these substances or these lesions, what we call, the sulfur granules, right? And this gram-positive these organisms of this actinomyces bovis may also be present, and can be stained, by using gram staining, and it can be demonstrated from those these abscesses by making this smear and all this, right? And finally, diagnosis. So, basing on the clinical signs and symptoms and the lesions, here particularly, this suppurative type of this, this rarefying this osteomyelitis, showing some lumpy condition of the jaw, and the animal may be very much this weak and showing this very painful condition of the jaw and swollen and all, and you can just confirm by isolating the organism from this pus material and all, or sometimes in the affected tissues using some special stents. And this very particular slide, as I'm showing here, so when you crush I mean, freshly after washing and all these things, those sulfur granules in between two slides. Okay, and see under the microscope, you will find such type of this radiating club like Indian club like this radiations or fungal this red type of this structure like this. Okay, so this is very much typical. I mean, so far these two diseases are concerned. Okay, so that's all for these two diseases. But one phenomenon here means you will come across, and sometimes in the examination you may come across, that is known as Splendor-Hopley phenomenon. Okay, so Splendor-Hopley phenomenon is nothing but in these two diseases, or sometimes in parasitic or fungal disinfection and all these things. So when the central causative necrotic area, where I mean you may find some eosinophilic deposits of the host-derived materials. Okay, some the hyaline type of these materials. I mean, along with the around this pathogenic organism, maybe this bacteria, the fungus, or sometimes even in parasites and all. And from there, they may show this type of this radiating. I mean, this structure radiating, and this club like the Indian club like this structure. Okay, so this kind of this reaction is nothing but due to the this antigen antibody this reaction, parasitic antigen or the fungal this. Okay, so this kind of this local antigen antibody reaction will show a very typical reaction or phenomenon where you may have this radiating this club like this structure like this. So this phenomenon, this very particular phenomenon, it is known as Splendor-Hopley phenomenon, and you may come across this very particular phenomenon in case of this actinobacillosis, actinomycosis, as well as in some of the fungal infection and even some parasitic fungus, where you may have such kind of this causation and showing this central and this radiating type of this reaction or these lesions, right? So these are some more this pictures showing this Splendor-Hopley phenomenon and the sulfur granules, or you can say the central this radiating club like this this structure, right? So that's all for this today. And like this means I'll give you in brief about some more this important bacterial diseases in the next class. Okay, that's all for today.
Thank you, sir.
Thank you, sir. Thank you.